Working as a nurse is really important to inform your research activities, and certainly working clinically gives you a really good sense of where the gaps are in terms of research and how we can improve patient outcomes and how we can improve patient care.
So the partnership with Epworth is really important for the Institute for Health Transformation. One of the great things about a partnership where some of our researchers are actually embedded in the health service, like with Epworth, is they can work across the executive, across the clinical staff and with the patients and community to identify projects that are really important. And so through doing that, they've developed a number of projects that have had benefits for the patients, for the broader community and for the health service itself, but also increase the capacity and capability of our researchers. They learn on the job and they get to do research that delivers real impact.
In the role of Chair in Nursing Research, I work across Epworth, and with my quite diverse clinical background, I'm able to work quite comfortably with nurses who are working in critical care and emergency environments, but also in rehabilitation and subacute care environments. And seeing them develop their project from a vague idea to getting a paper published and presenting at a conference.
In today's healthcare environment, patients need to know what they need to do to recover. It's not okay to be passive recipients anymore. So the research program utilising MyStay, which is a multimedia animation program which is using a combination of text, sound and graphics to give patients information and the tools they need to recover from major surgery. It's a program that is co-designed with consumers, so patients who have had those surgeries, the surgeons that work within the Epworth Healthcare Organisation, the physiotherapists, allied health, and also the nurses. So everybody has input into the design of the program, and it's really about giving patients tools they need to recover. Patients traditionally, when I first started nursing, might have been in hospital for up to 10 days after a knee replacement surgery. Now the average is 3. Not all patients are ready and receptive to receive information when it's timely for the nurse. So having a tool such as MyStay at the patient's bedside that they can pick up and access whenever they're feeling okay and whenever they're feeling well enough to listen is really important. And then they can go home with MyStay in their back pocket to go, okay, these are the exercises that I still need to do, and remember and watch how to do them so they can continue their recovery at home.
So one of the things with the MyStay app is it gives staff access to well-curated, evidence-based information that's easily accessible by patients and families. So their family, while they're waiting for them to come through theatre, actually can have a sense of what the next step is and what to expect.
The implementation of MyStay was really important to get robust data to make sure that it is going to make a difference. So in the initial trial was a randomised controlled trial that we did where we had a cohort of patients that used the MyStay and a cohort of patients that didn't use the MyStay, and we found the outcomes of that were really beneficial to the patients who used it. So they stayed in hospital on average a day less, they were more active, they had less pain, they were more satisfied with their stay at Epworth Healthcare overall, and they were more likely to refer a family or friend to Epworth Healthcare for that particular surgery.
One of the most exciting things for me as Director of the Institute for Health Transformation from our Epworth partnership is that projects that have originated from that partnership, like MyStay, are now implemented in routine healthcare across the Epworth healthcare group. And that's just a fantastic outcome for our researchers, but obviously also for patients and the healthcare community more generally.
We really aim to engage consumers at every point of the research development process and personalising the impact of the research on individuals and their families' lives.
MyStay has been a really great research project to be involved with our Epworth collaborators, and I look forward to many more projects coming out of this partnership.
It is so important, that partnership, to enable us to do the research that we do. So the research is really cutting edge, it's evidence-based, and it's making a difference to patients and their outcomes.